Hey, it's May the 12th, 2018. It's Dr. Jines here. Saturday afternoon, sitting out on the deck, and I had some random thoughts about how we talk to patients. I know that's one of those things that is listed as one of the things that we don't do well with patients. Well, they don't teach it, so it's kind of hard. And the new generation, there's just sometimes it's hard to deal with some of these older, cranky patients. So here's a couple thoughts. One, you want to make relationships, especially with the crankiest ones. You don't want to get sued. Learn how to like these people, but teach them. Doctor means teacher, and you teach them how to value your service. I did a video not too long ago about exams, and I verbalize my exams, and one of the reasons I do. So I had patients that way back when I was in an emergency room or in the dental clinic, and they would say something like, "Well, he didn't do anything for me. Just looked at me." Well, obviously they weren't valuing that 14 years of training to get to the point where I could make a decision clinically about whatever they needed in a rapid amount of time. So I started verbalizing all my exams, and when they hear the medical jargon or the anatomical structures and that kind of stuff, they realize, boy, he's being thorough. And doctor means teacher. And if you can teach these patients how to prevent the most common disease in all of mankind, and therefore not have to be on the treadmill of getting a filling every 2 years in the same tooth or crowns every 5 years, you're doing them a huge service, but you're also saving yourself from getting carpal tunnel, from having repeatedly do things that shouldn't necessarily be done. Especially if you're supervising their neglect, you're going to end up doing this work over and over again. But it's awful nice when you don't have to, and you get a filling that's 30 years old or a crown that's 30 years old and still intact. There's no caries, and the person's periodontal tissue's in great shape. You did a great job. And so, what we do right at the beginning is we get the patient in, and I ask them, "Why are you here?" You know why I'm here. I do this every day. So how about you? Why are you here? And I try to address that chief complaint along with giving them and imparting the philosophy of our practice. My goal is for them to not ever have to have any more dental work done other than cleanings every 6 months once we're done with whatever initial work they have. The way dentistry works in this century is we can start with a mouth that's bombed out and end up with a mouth that's perfect, a textbook mouth. The trick is stay there. Dentists get their teeth fixed in dental school, and they learn how to take care of them and manage it, and they don't end up having to be patients the rest of their lives unless they break something or whatever they shouldn't have to. So that's how I'd like all our patients to be. So we inform them of just that we can stop the most common disease, but if you expect me to do implants and crown and bridge and beautiful porcelain aesthetic work, it's kind of like building a deck on a house, and you're working on a fire feature, maybe water feature, an outside kitchen, and you look in the window and realize that the rest of the house is on fire. It doesn't make sense to do the pretty stuff until we've got that foundation corrected and the fires are put out. So we're going to talk about a couple little issues here in the next couple videos, and we'll see what we can do.